let's see. So how do they know they can trust the surgeon? What are some things they can do to find out if the surgeon's worth a darn? Right?
Yeah. So I mean, now with modern technology, you can go start Googling your surgeon. You can look at it, but a lot of times it's not accurate. People that leave reviews either leave reviews for extremely out of the ordinary good service or bad service.
That's it. Huh?
The middle ground, which is where you want a surgeon to be, you don't want a surgeon that's doing high end, only works on football players, because he's going to probably be expensive, or you know.
And now you wait months to see him.
And you wait forever, and they do a great job, of course, but you also, on the other end of the spectrum, you don't want a doctor that's got a bad reputation. And so the best way that you can do that, and I've had patients do this before, is they find other people that have seen that surgeon. They find other patitions.
Yeah. Like word of mouth.
Word of mouth.
And that's what we're trying to do now with physical therapists, surgeons, occupational therapists, anybody. Right. We're trying to build a directory and find almost like a Yelp review, even though Yelp sometimes is kind of garbage, so that people can leave a review. And we're going to work out a number system. So anything anybody can come up with that it'll help us rate someone on a star system, like this person should be pretty good, because there's different things. You may be well educated and have a fellowship, but you may be so damn busy you can't take care of them, right?
Right. And that brings up a good point with PTs as well. As I found this just with all the different PTs I worked with over the years, that I've worked with PTs that have every letter after their name.
Yep.
And every letter you can imagine. And that doesn't mean that they're going to be a good therapist.
Alphabet soup.
Yeah, I've worked with some therapists that have been through all of it, and they have all the letters, and I'm like, you're doing that?
I've seen it too.
Yeah, so I mean, and then there's PTs that don't have all the letters after their name, and they're probably the best PT for you.
I saw a guy with the smartest guy I knew, was a guy with a master's. You know what I mean? Mm-hmm. He runs his own business now, but he just had a master's, but he could treat patients like a champ. He knew everything, in and out.
But a lot of times they push for those letters after the name because it's marketable.
Yeah.
And so,
if for the company.
For the company and for the PT too, because if I'm like my dad or somebody's in another city and they're asking me, hey, I need to go see a PT, I'm going to go on Google because I don't live there, I don't know people, and I'm going to look and I'm going to filter it by people that have a lot of letters after their name.
The best way, right?
It means more education.
It means more education, more training.
Less time?
Yeah. And chances are, I mean, they are good. It doesn't guarantee.
So how do you know if they're competent? And how do I if you want that PT?
So you'll know pretty quick with your PT. Usually in the first visit or two.
How do you know?
You'll know.
Yeah.
It's how they build rapport. Okay. It's not always, especially after post-op rehab, because post-op rehab, you follow a protocol. It's fairly simple.
Yeah.
Right. It's not that complicated. You know what to do and what not to do. It's all right there. Mm-hmm. Right. Any good PT worth of salt can do post-op rehab for them. Right. But
you follow the directions exactly.
Right. Yeah. But what you got to find is the rapport that you build and the trust that you build, because that's the most important thing that we do as therapists is the initial trust.
Yeah.
Is building trust. So that's why I was saying, like, the first couple of visits, you're going to know if this is a good therapist for you or not.
Okay.
Because you'll just know. You'll talk to them because you're going to want to spend. I mean, you're going to be spending. Well, the first 6 weeks, it's once a week usually for just passive. But after that, I mean, you're going to be going 2 to 3 times a week for months. Right.
Well, maybe one of the things you can ask is like, what compensations should I be watching for?
Right.
That'd be a good way to find out if your therapist knows what they're talking about.
Right.
Yeah.
That one.
Yeah, that's to your therapist.
Yeah, ask your therapist. And we've already told you one. Right.
That's the big one.
Yeah, and then this kind of stuff.
Well, it's the whole.
Yeah.
So what I tell people is, once we start actively moving it, I have them stand in front of the mirror, and I'll put a line down the mirror, like just with a piece of tape or something, and have them line their nose and their forehead and their chin and their sternum and everything up with that line, and have them just do active flexion, no weights, right?
Right.
And I'm like, keep everything lined up on that strip of tape, and you'll see people, their first compensation, it's not this, it's this. They'll tilt their head over to that side, and that's where it all begins. So it's all about head positioning. So I don't know what happened with this case.
Surgeon got mad for you calling him out.
So I guess you would say it's more like an intuition. Like there's a process, and things should be going in that right way, and everything should be healing properly. But if you see something kind of out of the ordinary, where you're kind of like, ooh,
and that's where you
I haven't seen this happen, or I haven't.
Right. That's the thing. I tell patients, like, look, I know how this should go. Like, I'm looking for certain things to be happening on a certain timeline.
Right.
And as long as those things are happening, we're good. The pain you're having, that's normal, right? There's certain things to set the expectations about. But the PT is going to have to really know what they're talking about, know what
Right.
they're looking at.
Yeah, because like for a patient, like, they might feel like something is off and they know their body, but they don't know the process, but sometimes they might be right.
Right. No, and that's such a great point, because the patients know their body.
Right.
I had that guy that I told you about that sat in his apartment playing. He actually was a patient of mine before when he tore it. And I came in and I saw him the same day that he tore it. And I looked at his shoulder and he's like, man, we're not doing PT. I know I tore it. I know it's torn. I'm like, okay, well, we need to try a little bit. We need to see, because sometimes these do well. I believed him, but also I kind of needed to try some therapy with him to see how he does, because in workers' comp world, they don't usually send you for an MRI and an ortho unless it's like obvious. And his was pretty obvious. But they still wanted him to try a couple visits of PT just to see how it would react.
Yeah.
Because the dude's in his 60s. It's not healthy. But I believed him. But to talk about your point was that you got to trust the patients too, because they can tell. They might not be the sharpest crayon in the box, but sometimes,
and especially
they know
in that
their body.
area, they don't know about what's going on.
Right, and that's where your education and your trust that you build with him has to come in, because I've had patients tell me things before. I'm like, this guy's, you don't know what he's talking about, right? I know what I'm talking about. But they end up being right about a lot of stuff too.
Yeah.
So that's just a data point. Like what they're telling you and what the feedback they're giving you, that's a data point that you need to just stick it in there and wait for the data points to add up. And once the data points start adding up, that's when you're like, maybe there's an issue going on here.
Big question that patients need to start asking themselves during this process is, what did I do to be in this position, and what are ways I can fix it? So that's kind of a good thing to know.
And the question your therapist, so everybody's looking at it. Get more eyes on it, right?
Right.
Yeah, absolutely.
Yeah, and whenever a patient does get injured and you get in with a PT, you're going to be with that PT a lot. You're going to get to know each other really well, right? More so than with all my other patients. My surgery patients, especially the shoulder ones, I get to know these people. We become friends.
Yeah, it's going to be a while.
You smell their armpits.
Right, exactly. We get real close. So that for them is a great opportunity to do what you were just saying and ask questions about their work environment, about working out, about exercise, health, nutrition, all this stuff. You have access to this person that has all this great knowledge and information.
And if they don't have that knowledge, they're definitely going to find out for you.
Oh yeah, people ask me stuff all the time. I'm like, that's a good question.
Yeah, we like to
let me research that for a little bit. And I'll get back to you.
Be a sleuth.
Yeah.
Okay.
Yeah.
Cool. All healthcare providers aren't made the same. We all know that. Everybody should pretty much know that. Unless you're like our parents' generation or my parents' generation, we're like, okay, I'll do what I'm told. You know what I mean?
All those people, passive recipients of healthcare.
Yeah.
Which a lot of them.
I mean, and doctors, even you hear them say, well, don't try to be Dr. Google. But you know what? You need to learn. You got to educate yourself. How can a patient know they're getting proper treatment, any healthcare?
Quality
What
care.
do you think we could ask? What question could we find out? How can they find this information?
Yeah, that's a tough one, man, because the best answer is the internet, is get on there and start researching, but it's a swimming pool full of information that you don't really know. It's the same problem with internet research. Sometimes you're not getting great information.
What do you think the most important question you would ask if you were trying to find, if you had to have shoulder surgery, what question would you ask to know you're going to get the best surgeon, best physical therapist, best what?
So the surgeon, I would research them.
What would you Google? Yeah,
I'd just research them, figure them out, look at their pages and everything, and see what I can find out about them. But looking for patient testimonials and like Amazon reviews, right? You look at what people write on there about these people.
See if it's garbage or if it's real.
And sometimes like those Amazon reviews, you can read like, this guy's an idiot.
Or they're different country right now.
Yeah, this guy doesn't. He messed that up.
Yeah.
Because sometimes surgeons get a bad rap, not because they're bad surgeons. It's because they don't have good bedside manners.
Yeah.
And so
which doesn't mean that's a bad surgeon, because
right.
I mean, surgeons are supposed to be behind the scenes.
My surgeon that I had, he was a good guy. He was a nice guy. I wouldn't want to have a beer with this guy or anything.
Yeah.
But he was an excellent surgeon. So you kind of have to trust your intuition, but you have to trust it only to a certain point, because your intuition is going to tell you this guy's bedside manners are terrible. Run away from this guy.
So patient reviews are good.
So it might be different from physician or surgeon to therapist.
Right.
Because I mean, surgeons they're not really spending so much time with the patient.
Right.
So maybe their bedside manner can be mediocre.
Yeah.
But they're damn good surgeon.
But it's different with PTs.
Well, right. In
reverse.
PT, it's the reverse, right? Because
Right.
you want someone with great bedside manner that's going to ask the right questions to the patient, as well as, provide them with the education that they need.
Exactly.
You said something about having to put hands on the patient, right? With your student physical therapist. You tell them if the patient they ain't putting hands on that patient, they're not doing it right.
Right. Well, that brings up a point with doing the passive. A lot of people will talk about the passive, and I have all my students do passive on people that are fresh. If we have a fresh surgery that's pretty new, I have all my students do it, and I watch them like a hawk, and I'm like right there with them, mostly so the patient will trust us. But that's the one thing that like blows the minds of my students is like hug their arm, get it right up against you, and use your other hand to block their shoulder. And that's the position you do passive in. This whole thing where you grab up next to the glenohumeral joint and move it around, that's great and everything, but the most important thing with passive is they have to relax. So get it here, hug their arm, make their arm become a part of you because you're moving their arm. That arm belongs to you while you have it. It doesn't belong to them anymore. It's kind of weird. And and I'll say that to people. I'm like, here, I'm giving you your arm back. And then I slowly, and they take it, and now it's their arm.
Yeah.
Should there ever be a time you go see a physical therapist where they like during your initial evaluation or something like that, or during that treatment, that they don't touch you? The therapist should almost always have hands on you if you're doing an evaluation or something like that, right?
At post-op?
Yeah,
absolutely.
I mean, because there's a lot of times you go in and people they get a bike, they get a e-stim, they get ultrasound, they get laser, they get ice, and then they go home. You know
that's not PT.
Yeah, that's
That's a Hummer clinic.
See, like
what's Hummer mean?
Hot pack, ultrasound, massage, e-stim, repeat.
There you go. Until you run out of insurance.
Now I will use e-stim on post-op people.
It helps
For pain control, and I'll get them. I'll use it in the clinic one time, and if they like it, I'll get them one to use at home. And I got a good rep. She takes care of everything.
Cool.
They can use it. At home.
There's places for modalities. That's what Ellie said. All the stuff he just said to Hummer. That's modalities.
Yeah.
There's a time and place for it.
It's the feel good stuff.
It's there, but it's not the only thing that you need. Yeah.
Now, whenever I have a patient that I'm doing passive range of motion on, I am having a full-blown conversation with them about random stuff.
Yeah.
And I like people. I like talking to people. But I'm doing that because it helps them relax.
And
and you can see it visually on people's faces when you stop talking and you're still moving the arm, they'll grimace and they'll walk up, right? But you start talking, they and then it's back.
Yeah.
So I mean, we talk a lot, and if I have a patient that is not very talkative, doesn't want to do it, like I have a guy right now. It's the same guy I was telling about. He comes in, he wears his headphones, and he watches YouTube videos while I do it.
And it still makes his mind distracted.
Mm-hmm. Yeah, and we talked a lot about breathing techniques. Breathing is so important. A lot of PTs I don't think focus on this enough. Like I have him before we start doing it do this thing where you cover up one nostril, you take 10 deep breaths through one nostril, out through the mouth, purse lips, and then 10 deep breaths through the other nostril. And you do 20 breaths, right? One in each side, and it has to come out through the pursed lips. And as soon as he does that, boom, we start. And that's a great relaxation technique. Next time you have about a minute to kill, 10 on each side.
Yeah.
And
10 on each side.
And you go all the way to full expansion too, like
like this,
as far as you can go.
Don't blow bubbles.
Oh, like a.
So you suck it in and out the mouth.
So I block it like this, or go like this.
You probably want to do it like this, because if you do it like that, you move the septum over.
Oh, so like this?
Ew.
Yeah.
That sounds terrible.
You don't got to jam your thumb in there.
Oh.
And then
block it off.
For the purse lip breathe out.
Yeah.
Okay, cool.
Yeah.
Cool, man.